Tunneled catheters. The tunneled catheter is an extremely durable device that can remain in place for several years. It is made of silicone and has a Dacron cuff that helps to secure the catheter into the subcutaneous tract. Common brands of tunneled catheters are the Hickman, Groshong, and Broviet catheters. The tunnel catheter can be used for any type of intravenous infusion and is well suited for parenteral nutrition and chemotherapy. The catheter is surgically inserted by a physician and usually requires anesthesia during the insertion. A portion of the catheter travels through a subcutaneous tract until it reaches the subclavian vein, where it enters into the venous system, with the tip residing in the superior vena cava. The catheter is usually removed by a physician in the office or clinic setting. The tunnel catheter is available in single, double, and triple lumen styles. As with the PICC catheter, the single lumen is associated with fewer complications, while a multi-lumen catheter may be indicated if there are multiple therapies ordered. The catheter comes in an open-end style, requiring a heparin flush to maintain patency, as well as the valved style that requires only a saline flush to keep open. There are several complications that can occur with the tunnel catheters. The two most common are infection and occlusion. Infection can occur within the bloodstream or at the catheter exit site. In some cases, the catheter is removed and antibiotics are ordered to treat the infection. Good hand washing and strict aseptic technique are a must when working with the tunnel catheter. A tunneled line occlusion can occur when a fibrin sheath covers the internal end of the catheter, causing either a partial or complete occlusion. Blood backup into the catheter lumen with improper flushing can also precipitate a catheter occlusion. In some cases, a declotting agent may be used to restore patency in the catheter. If this is unsuccessful, the catheter must be replaced. Other complications include outward migration of the catheter and phlebitis along the course of the subclavian vein. The tunnel catheter dressing change is a sterile procedure that is completed weekly and is needed by a trained RN or the patient caregiver. The needleless cap is also changed at this time. If gauze is used under the transparent dressing, it must be changed after 48 hours. As mentioned previously, there are several types of needleless caps available for use. With most catheters, it is best to use the positive pressure cap, as this exerts a continual forward pressure of the flush solution into the catheter. It is extremely important that the catheter not be clamped, as this disrupts the positive pressure function of the cap. One exception, changing the cap on an open-end catheter. The flush should be administered using a push-pause motion, leaving about 0.5 ml of solution in the syringe. Protocols for flush amounts vary, but in general, 10 milliliters of saline should be used before and after medications to clear the medication from the catheter. 20 milliliters of saline should be used after parenteral nutrition infusions, chemotherapy, and blood draws. If the catheter is open-ended, it will need a final flush with 10 unit per ml heparin.